Hello. For a second there, I was like, is the microphone not working? But no, as the noise gate was working, so it wasn't registering my chewing. Oh yes, I need to. How does modding work here? You're late? Look, I'm sorry. I got caught up with a phone call. Community? Is that right? No. Settings. Cool. I was just waiting for... Oh, hi, Bonnet! You're on YouTube. You're on the vertical one. Because I'm on vertical and the other one. Okay, anyways. Sorry, I was waiting for the ad to finish. Hello! Aloha, my computer has suddenly started to, take off. It's trying to take off with me, but that's okay. Hello, I have a question. I will wait till you are ready. I am almost ready. I wanted to set up one more thing. Lev! Hi, Sucho. Copy link. Yes. Hi. You can start writing your question, or I will get it in a second. Viewer attack is what I'm trying to figure out right now. This, and then it's 1920 by 1080. Okay. And this should be muted, and then I will go to... Where is it? My Twitch. Is this an open Q&A about anything? Or are there categories or boundaries? Relatively open, just like nothing too heavy or too serious as per our usual rules. Yeah. OMG, Lev's PC sounds like an F-22 engine. Can you guys hear it? I hope not. You might be able to though. Sorry. But yeah, relatively open. Major the King, hello! I like that you have emotes in your, or emojis in your thing, in your username. But yes, relatively open. Like, but hopefully more about psych stuff. Yeah. But no heavy things. Don't ask me about suicide. I can't give you recommendations about medications or what you should do with your life. Wait, let me see if this works. Disclaimer. Yeah. There we go. Where did that thing go? I had a thing. I had where do they put the extensions? There it is. My extensions. Nope, not that one. Okay. Okay. So. Good afternoon, streamer. Love your model. Hello, Cookies and Cream. Thank you for the compliment. I appreciate it. Good afternoon. How are you? Nice disclaimer, small step improvements, little by little. I know. Little by little, indeed. Okay. I'm curious if this will work. Does anyone who's online, even though Lev is a doctor, trusting advice like Google either a grain of salt? Yeah, exactly. Is it? I'm going to go to my stream and see if it comes up. Let's see. Okay. Like, how do... Like, do you guys see this thing? Do you guys see the viewer attack thing on your Twitch? Or is there another thing I need to do? Let's see. Tutorial. Next. Okay. Ah! That's actually very funny. Okay, there we go. It's working. Yay. Splat, indeed. Okay. I'm glad that worked. So now you can throw things at me if you like. Hello, I'm going to sub. Thank you, Easton. What do you play? I play a lot of cozy things. Oh my god. Well, I'm glad that one missed me. Thank god. I play a lot of cozy things. I play Hades. I play like Stardew. Sorry, I'm trying to dodge the tomatoes. Okay, so this is a question from my friend whose mother is a lawyer. They've always seen ODD, sorry, oppositional defiant disorder, and the other chronic disorders as something that's been used to malign children from disadvantaged backgrounds, e.g. dealt with racism or adopted. How do you tease apart the difference for a diagnosis? Oh, that's hard. So here's the problem, right? Is that, like, mental illness doesn't discriminate. Like, no one, I don't think that there's, like, really, all other things being equal, right? All other things being equal, I don't think that there's really that much of a difference in, like, mental health stuff. I guess I'm just dodging tomatoes all day today. But I guess there's like a little bit of some, it's hard to tease apart, but basically I personally feel that all things being equal, the probability that someone is going to end up with any given mental illness is like kind of the same, right? But there are things that predispose you to mental illness, and those things are like trauma, childhood instability, like especially when it comes to financial instability, food instability, adult instability, like if limits aren't set well with children, if they're in an environment that's unsafe, like all of these things predispose someone to mental illness and to developing a personality disorder. And that unfortunately does end up running along the same lines as other like discriminatory lines, right? Like, unfortunately, it is the case that someone who does come from a background of being adopted is going to be more likely to have a traumatic history, right? Either because they know they're adopted and then there's the whole trauma around your parents giving you up, or they knew their parents, now their parents are gone for one reason or another, or they're taken away from their family, which happens very often, or, you know, all of those things. So it's hard, right? Those things do predispose kids to developing ODD and, you know, conduct disorder and all that stuff. But that doesn't necessarily... It's hard. It's really hard. And I also think that it is definitely the case, though, that there's more I feel like doctors often are more willing to see it in a population they expect to see it in. So that's also definitely a problem. So anyways, it is hard to say. It's hard to tease out. Especially because a lot of psych stuff, when it's like you need to tease something out really like subtle in psych, the answer is get to know them over a long time. Get to know them over a long time and talk with them and get to know their family and get to talk about things. And so it's like, it's hard, especially because a lot of times it's like you're asked to do an evaluation and you're meeting someone for the first time and you don't know anything about them and no one else knows anything about them either because their parents are gone or they're in foster care or whatever. And so it's hard. It's just hard. Someone followed. I'm sorry. Mars4322, thank you for following. I love how you are called Major the King. Thank you. I try to call people out. Are you going to be face real? No. This is it. I'm anime girl forever. Hussein Rad. Thank you for your first time chat. I don't know what that is. Harley338 doorknob. I don't know what that is. You just... Did you send an emote that's just a silver doorknob? I don't know what that means. I'm kind of concerned it might mean something that I should know, but you know what? It's fine. Someone else asked... Oh, by the way, if you're getting viewer attacks through channel points, you need to like open the overlay over the screen to use it, is what it said. So, also the emote ones should be free, by the way. I'm pretty sure. Someone else asked something. How can you tell the difference between an addict coming in for meds or real patients who need help? Also hard.
Doc, I have to ask, what does an old, mid-30s millennial do to get over the feelings of frustration towards a two-pronged attack? The first is being let down by almost everyone around them, and the second is never succeeding in anything they've ever aspired to in life?
Oh my goodness. Okay, that is a big question. Let me answer Rose's, I think it was Rose. Yeah, Rose's question first about addiction and stuff like that. Man. Again, it's hard because like addiction and like dependence on substances, be it like recreational substances or like meds, it just happens, right? Like people who get prescribed opioid medications because they have cancer that's causing horrible bone pain or something will also develop dependency, you know? Like they'll also develop a physical dependency on opioids. And so like, it's hard to say, but the way I tend to think about it is like, I feel like it's hard. Doctors have a really hard time with this. Doctors have a really, 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 really hard time with this because pain is subjective and it is you can't measure objective things for pain. Like there's things that you can kind of use as like a corollary of like if someone doesn't look like they're in pain at all, right? Or rather like if someone's like, I'm in pain, but they're like walking around fine on the foot that they say hurts to walk on, you know what I mean? Like if they're directly contradicting themselves, that's one thing, but for the most part, like if someone says they're in pain, you can't say like I can disprove that some way. You can't, right? And so like at the end of the day, it also ends up being very susceptible to biases and stuff like that, right? Especially for people who have like chronic illnesses like sickle cell disease or, you know, cancer or any other thing or fibromyalgia or chronic back pain, like things where it's like, we don't even have a great sense of like what correlates to more pain, right? So it's hard. That is an unanswerable question. No one actually knows for sure. But the things that you're able to tell kind of more for sure are like function and stuff like that, you know? Like if someone is using a substance not to be able to function in life, but to the point of being intoxicated and not functioning, That's usually something. But again, like a lot of the behaviors that doctors will attribute to someone who's med seeking, like waiting, like counting down the seconds until their next dose, or doing things to try to get more meds, is like, that's just how anyone would act also if they were like really, really in pain. Like we all do some level of this, right? Like if you have a really, one of my attendings has this example of like, I have a really, really, really bad cough, right? But let's say I go to see the doctor and I'm like, oh, I have this really bad cough. And then suddenly I don't have the need to cough, right? I'm not better, but maybe I will like fake a cough to prove a point. And it's not like fully lying, but it is exaggerating for a purpose. And we all do that, you know? And so, I don't know, even if someone is playing things up, like you can't say that that means that they don't actually need meds. It's just, it's hard. It's hard. Okay. I can't stay the whole stream. That's okay. The setting of professionals is very limited as well. Yeah. Only ever seen the diagnosis get used to like put kids away. Ah, gosh, that's really sad. That's really, really sad. And I think this is the difficulty with psychiatry too, is that a lot of our diagnoses, they're not based in, oh, you can, oh, yay! You can stay the whole stream. Thanks, I'm glad. I feel like the problem with psychiatry is that all of our diagnoses are like not, based in like lab values or objective things. Like you don't get a lab to see if someone has a personality disorder, right? You don't get a lab test or a measurement or something like that, you know? And so like, it's all symptoms and stuff put together. And so it's really, I think rather than this person has XYZ disorder, therefore they should get they should be, institutionalized or incarcerated. I don't think that's the answer, right? Because everyone's different and psychiatrists can and do disagree on diagnoses. And it doesn't mean that anyone's necessarily wrong, right? I think rather, and this is probably how most psychiatrists think about it, is more like this person is hurting other people, or this person is demonstrably unable to keep themselves safe, or to keep themselves safe, or to keep themselves from hurting themselves or hurting other people. And the reason for that behavior is maybe this diagnosis. The diagnosis is not the reason why they need more help, like hospitalization or something. It's the behavior that is the reason they need more help. Does that kind of make sense? Right? It's like, there's plenty of people who probably have these personality disorders, and also there's also like a bias, right? Like there's probably a lot of kids who have some version of like ODD or conduct disorder or DMDD who aren't having serious enough issues at home or at school where they are getting into legal issues, you know? So anyways. Lev, how can you tell if a patient's condition is mental or physical? Oh, that's a simple question. You can't. You kind of can't. Like, patient comes in saying they have body aches, pain scale of 9, scans, blood tests come back clean. This is the thing. We assume in medicine that our scans and labs can cover everything medical that could possibly be happening to someone. And there are times when someone has all of the tests come back clean, and it could still be, like, not psychiatric. Right? Or rather, like, whether or not your tests show anything or not doesn't necessarily mean that you do or don't have a psychiatric reason for whatever situation is going on, right? It's more about, like, what it looks like and the picture and the, like, is it correlated with other stressors, right? Does it not make a lot of sense in terms of the things we do know about, like, the body? Like, for example, like, oh, it feels like my entire hand goes numb. And it's like, well, there is no nerve that only goes to your entire hand. So that doesn't totally make sense. Or there's an issue that happens when you're being examined, but then doesn't happen when you're not being examined. And it doesn't necessarily mean they're faking it. Like sometimes that just happens, you know? But anyways, who knows? Yeah. We really don't. It's again, hard question. We really don't know. That's the thing. Because someone could have like some horrible medical reason for their pain, and then the psychiatric stuff is also making it worse. Or they could only have a psychiatric reason for pain, or they could only have a medical reason for pain. There's really, you know, ultimately, the way that I think about it is like sometimes you don't know the answer. Sometimes you're never going to know the answer. And do you need to know the answer to be able to treat someone? Not necessarily, right? And this is what I usually would say is like, well, if someone has like a psychiatric reason for some physical issues, like somatic stuff, pain, discomfort, whatever, there's usually some underlying thing, right? Of like really bad anxiety, really bad depression, some personality structure issues, something like that. And so regardless, like if you even suspect that it could be related, usually you can say like, well, maybe it's the reason, maybe it's not the reason. Either way, it's not helping. So it would still be of benefit to treat this underlying psychiatric condition. And maybe it'll help with all this other pain stuff. And maybe it won't, but at least you're not also dealing with this. So that's a lot of psych. Like you sometimes don't have a straight answer. And then you have to come up with a plan even though you don't have a straight answer. Like, I don't know, right? There's times when people have a diagnosis and you're like, I don't know. Okay, Cygnus, I'm going to answer your question. I just have to go back and find it. Okay. What does an old mid-30s millennial do to... Thank you for the little baby. I realize now that like the viewer attack for the emotes just like puts them on screen for a little bit because there's no splat, but that's fine. I think it's cute. Frustration towards a two-pronged. The first is being let down by almost everyone around them, and the second is never succeeding in anything they've ever aspired to in life. Okay. This is difficult, right? Because my feeling is that also you have a new follower. Oh, I do. What was it? Cookies and Cream, right? Thank you for following. It's hard. It's so hard. And I feel like it's not even a psychiatric thing at that point. That's just like a life thing. This reminds me, let me look it up to make sure I'm not saying it wrong. There's something called like the Erikson life stages, which is like, or the Erikson stages of development, right? Which basically is the idea of like the different conflicts that occur in different areas of your life. It's me again. I found you on the Twitch side. Hello, Cookies and Cream. Thank you for finding me. Oh, we're talking about factitious disorders. I love factitious disorders. I'll talk about them in a second. So there's these different like conflicts that occur in different parts of your life, right? Like, for example, when you're a baby, yes, there is still like a psychiatric development, and the idea that this is all like theory, right? But this is just based on like, we see this in a lot of different people, and it kind of makes sense. It intuitively makes sense to me. Like when you're a baby, it's trust versus mistrust. Like, do I trust other people to take care of me, or do I not trust other people to take care of me, right? Or like a really another one that I think is easy to understand is like middle-aged one, which is generativity versus stagnation, which you can already tell basically is like midlife crisis. Like that's what people are talking about when they talk about midlife crisis, is like a version of similar to what Erikson is talking about with like when you're in your middle age, you have this internal conflict of like, am I stagnating in life or am I still generating value for other people, right? Especially because usually at that time your kids have grown up and so you're not like actively a parent anymore, you know, all this stuff. So I feel like that's part of what your question is. And okay, this is what I'll say, is that sickness, like, I don't want to like psychoanalyze anyone. So that's not what I'm doing, I hope. But just from the question, it feels like there's a lot of external stuff, right? Because like that's kind of the basis of the question, right? It's like everyone around me and everything around me is horrible, right? Or you know, hasn't worked. And there's like, and I imagine there's some of that too with like achieving things that you aspire to, right? Because a lot of achievement in life isn't fully within our internal control, right? Like, you can control like how hard you work and how long you work and what you're interested in, but you can't necessarily control 100%. Like, well, what is the ceiling of your ability, right? Like, can you get into this school? Can you get into that job? Can you whatever? Sorry, the tomatoes are killing me. Yeah, and like I feel like a lot of, this is my personal experience also, I feel like a lot of dissatisfaction with yourself and with life comes from feeling like you're not in control, right? Like you get this feeling of helplessness when you feel like nothing's ever going to go well for me, and everyone hates me, and everything's out to get me, and nothing is going to ever go well. Like, that just feels awful, you know? And so you sort of feel like, well, there's no point. Why am I even doing anything, right? My friendships don't work out, my work doesn't work out, my life doesn't work out. And like, ultimately, the things that you can't control are the things that you can't control, right? Like, not to be reductive, but like, the government, oh, hello, how are y'all doing? What's going on? We're doing this Q&A. I'm a psychiatrist. Hello. Yes, I am a health professional. Guga. Wait, Guga like Big Brother? Because that's funny. Anyways, I'm getting off track. I was talking about, yeah, so for example, like, unrest in the world. Like, I imagine that the Great Depression was not helpful for people's mental health in the 1930s. You know? Like, I imagine the Great Depression was not helpful for anyone's mental health during the 1930s. And if someone was doing well mentally, they probably had other issues. Like, I don't know if I trust them. And like, oh, there's an ad coming soon, so I'm just gonna continue down this train of thought and not say anything like super specific to the question. I feel like, oh, ads were snoozed. Great, perfect. I can finish my thought. There's a normal amount of like distress that happens when life just sucks and external stuff just sucks. And when you put your happiness, or when it feels like your happiness or well-being or contentedness is dependent upon other people and other things and the world and things that you can't control, then it gets really easy to be depressed, you know? Okay, let me read this thing that you said. I mean, my question for you, Sickness, would be this: what you're saying makes me kind of sad, because it sounds like you feel like there are no good people in the world, or that like everyone is a horrible person. And probably it sounds like your life experiences have led you to that, but that probably is part of what makes it hard to make relationships, right? I imagine it's hard to make relationships when you're waiting for someone to like disappoint you. So it's tough. It's a tough thing. But if I could make any, like, if I could have any thoughts, my thoughts is, this is my general thoughts for like most people, is that it usually helps to wait, actually, I'm gonna teach you guys something. I'm gonna teach you guys a skill called behavioral activation. This is like a cognitive behavioral therapy thing, just like really quick, because I feel like it helps most people, even if you're not like depressed or anxious or whatever. And the idea is, every day, do something that either gives you a sense of pleasure, oh, thank you for the follow, or a sense of mastery, like either a sense of pleasure or a sense of mastery. And oh yay, we reached the follow goal, woo! So pleasure can be like anything, right? Something that makes you feel some type of joy. It can be a physical pleasure. It can be like, I'm going to just enjoy my cup of tea. I'm going to have ice cream. I'm going to listen to this music thing or whatever that makes me happy, right? Sense of mastery is like a sense of like accomplishment. Oh, Hotana! Thank you for the raid. Thank you for the raid. Hi. I'm Lev. I'm a doctor. I'm talking about doctory stuff. Hi. Thank you for the raid. I hope you're doing well. I hope if you need to raid and run, that's okay. I'm talking about psych stuff. I wanted to finish my thought before I get hit with another ad. Okay, let me finish my thought real quick. So, behavioral activation. Sense of pleasure or sense of mastery. Sense of mastery is a sense of accomplishment, right? Like, and it can be anything. It can be like, I brushed my teeth today, you know? Or I put away 2 items of clothing. Like, it can be as small or as big as you would like it to be. But I think the thing that's helpful about behavioral activation, to me, in my opinion, is the purposefulness of it, right? Because for most people, when we do behavioral activation, it's not necessarily things that we weren't already going to do. But I feel like there's a difference between saying, I am going to do this thing because it makes me happy, and that's it. And I'm doing it on purpose because it gives me pleasure. Is a little bit different than just sort of absent-mindedly doing something, right? In the same way of like, I'm going to do this and that's an accomplishment. Helps, right? And those are things that you can control. Like, you get to decide what it is that you're going to do for yourself each day. And it helps to remind you of the ways that you can make yourself happy, right? That's what I think. And this is also for depression. The reason why it helps is because, like, I don't know if you guys ever get stuck in that loop of like, I don't want to do anything, so then I don't do anything, so then I really don't want to do anything, so then I don't do anything, so then I really don't want to do anything, so then I don't do anything, so then I never do anything, and then I get really sad, right? Like, you can put yourself into that kind of negative loop even if you don't have depression, and it's way easier to get into that when you are depressed. And the only way to get out of that, or the best way to get out of that, is to do things, hence behavioral activation. Do something, do anything, you know? Get out of bed, stand up. Oh! Why are you throwing tomatoes at me? Thank you for following, right? Like, it could be as simple as like, my behavioral activation right now is I'm gonna stretch because my back kind of hurts and I need to stand up, you know? That's it. But that's something. You know what I mean? And so like, and also it takes out of the equation the thought of like, do I want to or not, right? Like, sometimes you gotta do things that you don't want to do. Sometimes there's some things that you gotta do regardless of if you want or don't want to. It just is. You just gotta do it, you know? You're a real doctor, right? Yes, I am. I cannot show you my actual physical license, my physical degree, because that would dox myself, but I promise I am a doctor. Because all people, progress is progress. It's all that matters, no matter how small their progress is. Yes, exactly. You're still a raid. No, yeah, you are still a raid. Doesn't matter if it's 1. It's fine. It's set to accept 1 because that's fine. Because I don't care. Oh, thank you. How do you choose what kind of methods of like talk therapy when you're working with a patient? Oh, that's hard, you know? Like it's hard. It kind of just depends on what their goals are. And also it kind of depends on what they want most of the time, right? I would split. There's like so many different kinds of therapy. It also kind of depends on what you know. There's so many different kinds of therapy, right? Like, and a lot of them are like the more specialized ones you do have to be trained in, and not everyone is trained in every kind of therapy. So there's ones that can get super specific, like exposure therapy for OCD is like a very specific kind of therapy. Thank you for throwing a tomato at my face. Yeah, like that's a very specific kind of therapy, and you have to like know what is it? You have to know how to do it to be able to do it and to offer it. And usually it's like they have OCD and that's why you would want to do it, right? But basically, this is true in a lot of psychiatry, is that like a lot of times people kind of know what they need and what they want. So like if someone's coming to you for therapy, it's because they have some sense that like something is wrong or something could be better and they want to feel better, right? And most people, even if they've never been in therapy before, have like an idea of what they kind of would want. And so if someone sits down and is like, yeah, my last therapist like just talked so much, then you're like, okay, then maybe you need something where you get to talk more, and that's more like talk therapy. Or someone's like, I just wanted like advice, I wanted like I want to feel better now, I want some strategies for how to deal with this, like I don't want to just sit here and talk, I want to feel like you're doing something. Then like, you know, that's more like cognitive behavioral therapy, you know, like roughly. This is a very rough approximation, and this is also for me, a psychiatrist who's not like I'm not as much of an expert on therapy as someone who has a PhD or a PsyD like in psychology, right? Because they actually do much more therapy training than I do, because most of my training is towards like medicine and medications. So anyways, yes, hello, I love your model. Thank you, Mimiko Octo, and thank you for the follow. The thing I struggle with most is survivor skill and PTSD, but small things do help. Yeah, I honestly, this is my bias. Like we all psychiatrists have a bias in terms of what therapies they feel work better, what works better with their style. Like there is no such thing as the best one, but I feel like my personal bias is that I feel like mindfulness and living in the moment and like taking the small things and not thinking too far ahead or too far behind is good for most people. How do you do something when there's not much time for it? Well, it depends on the thing. It depends on the thing. If you be more specific, what is your specialty? I am a psychiatrist. Like even now, I listen to all of that and study at the same time for the Friday's big test. Oh, okay. If it's like very literal, like I have things to do and I don't have that much time, I am such a hypocrite about this. So take this with a grain of salt. Like again, this is how like doctors are the worst patients. I am also the worst patient.
If it makes you feel any better,
oh wait,
I appreciate you. Sorry for asking such a heavy-handed question. I usually am able to keep things together and vibe, but today, I couldn't. You're a good person.
Oh, thank you. Thank you. I'm glad you feel that way. Yeah, and the thing is that like there's only so much that I can do or that we can talk about here on a stream, right? Because this is like not a psychiatrist's office, and this is also the sort of thing, it's like we talk about this all the time. If someone's like currently going through trauma, that is not the time to process the trauma, right? Like there's always a time and a place for everything, and so like this isn't the time and place for most things, but if I can help even a little bit or talk about it in a little bit, I think it's helpful, because I want to, part of my goal of doing any of this was like general psychiatric knowledge for more people. Yeah. Okay, doing more things, multitasking is not possible. multitasking is not a thing that humans are able to do, unfortunately. Like, there's lots of studies that show that when you multitask, you actually are slower than if you just did one thing and then did another thing. And yeah, and that's different from like if someone with ADHD, for example, like listening to music to get some extra stimulation, you know? Oh, thank you for the follow. Right, like if it's like, oh, I'm listening to music to get some extra stimulation because I have ADHD and so I'm chronically understimulated and this helps me focus, or like I'm gonna chew gum and this helps me focus, that's like different because that's not really doing another task. But if you were like trying to like memorize song lyrics while also like doing your homework, it's just not, you can't do that. Your brain doesn't do that. Your brain doesn't separate that way. And so multitasking is sometimes more fun than doing one thing at a time, and I do think that something being more enjoyable or more fun is often a reason to do it, even if it's less efficient. But if you need to be efficient, one thing at a time, just like focus on one thing and then focus on another thing, right? Because every time you change your focus, you have to like start up again, right? And be like, oh, where was I? What was I doing? And get into the mindset and all that stuff. And so switching back and forth constantly is just not good. Winter! Sorry! Thank you for subscribing! Thank you for your 4 months of subscription. Out of curiosity, similar question. Out of curiosity, how do you time manage practice and content creation? I don't know. Well, so right now my schedule is like pretty like flexible, so that helps. I have a calendar. I put everything in the calendar and then I do what the calendar tells me to do. And then the other part is like, I don't know, I guess I don't know if I do manage it that well, you know, because like I just do a lot of I try to have a sense of like things that I can do at any time, anywhere, and then things that like I need to be in a specific place to do, right? So this is why I end up like doing a lot of like, for example, this viewer attack thing. I end up like putting it on like on stream because I'm not at my streaming computer most of the time, right? So like I have a Notion actually. I have a Notion where I keep track of everything. I like put everything I needed into like a Discord server that I share with just myself. That's like, okay, here's the browser, like I set everything up, here's the browser link, here's the dimensions that you need to do, make sure that you set it to mute and put that on your screen. And then I set everything else up like between appointments. So yeah, so like I have a list of like things I can do remotely and things I have to do from home at my streaming computer, and then I just try to get some things done and try to prioritize. My to-do list system is basically assigning a date to everything, and then if I get to that date and it shows up and I don't want to do it, then I move it to another day. That's it. So at the end of the day, my to-do list has to be empty because either I've done it or I've moved it to another day. And then also just like trying to batch things, you know, like trying to find, oh, this is another thing. I like trying to find ways to make things more efficient. So like for like shorts and stuff that I make, like probably takes me like an hour or two to make all of them for the week. Yeah. So that's it. Okay, I was low-key judging myself. Nah, don't. Don't. I mean, if I was like fully working like in the hospital on the unit like 8 hours a day, I couldn't do the amount that I do now. It's because my schedule is like really flexible and I have lots of little bits of time. Let me look through the list. Thank you for following. Zanza asked, what do you do when you don't feel like you belong anywhere, even when you have people that love and care about you? Oh. Gosh, that's hard. I don't know. I don't think there is anything specific to do other than to like try and see why you feel that way, right? Because there's a lot of different reasons someone could feel that way. It could be because you are having issues with your interpersonal stuff, or, you know, It could be because of like depression. This is the thing with depression, is that I honestly, in my mind, I think of like a lot of mental illness as like a little demon in your head that's trying to trick you all the time, right? So depression is a little demon in your head that's trying to trick you into thinking that things are worse than they are, right? And so like sometimes that's the reason why. It's like, oh, it feels like I'm never going to be good enough because the little depression demon in my head is constantly telling me it doesn't matter how good you are, you're never going to be good enough. And so then maybe the solution is like therapy and meds, right? Because this is what I say to myself all the time. Like, I have really bad anxiety. This is what I say to myself all the time. I have really bad anxiety, and the problem with that is that like I end up doing this sort of, what is it? It's like oh, what if everyone hates me? Like I've always had really bad social anxiety, which makes it really funny that I'm doing this. Oh, thank you for the subscription. Thank you, Yuki. Thank you, Yuki, for subscribing. Wah! 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 Thank you for subscribing. Yes, catastrophizing. Yeah, sometimes I end up catastrophizing. Like, oh my god, everyone hates you, you know? And then like, sure, you can, like, when you have that kind of anxiety of like, what if this person is mad at me anxiety, right? You can do the cognitive thing of like, well, if they were mad at me, they could tell me. If they were mad at me, they would have done this or done that, and they didn't, or they've never been mad at me before, or whatever. Like, you can do all that cognitive stuff. Sometimes that's enough and that's good enough. But like, what I try to remember for myself and for my personal brand of anxiety is that like, sometimes you can't logic at the anxiety demon, you know? Like, the anxiety demon in my head that's like, everyone hates you and you're terrible, is like, it's not gonna go away when if I present evidence to it. It's just gonna be like, well, you don't know. How could you know? Your perceptions could be wrong. You can't read people's minds. It's always possible. And so the solution is not to logic at it. You can't logic that anxiety away. It's just to be like, sure, yeah, yep, yep, maybe they do hate me. Okay, that's fine. And then that's the way you like cut the power out of you like take the power away from the anxiety, as it were, right? Like, this is something one of my first therapists told me when I was in school. I was like really anxious about teachers judging me, and she was like, well, how long are you going to be in school for, right? She's like, there's 12 years of public school, 4 years of college, 4 years of medical school if you're going to be a doctor, and then 4 years of residency after that. That's like 20 plus years. You think in that 20 years, no teacher is ever going, like, the only way you'll be happy is if in 20 years, no teacher you ever talk to is ever going to be unhappy with your work. And I was like, that's true. That's true. So yeah, you know, it's fine. Someone asked a question about how to diagnose things. Okay, so the short answer for like diagnosing PTSD is like a psychiatrist diagnoses it, and there's like a criteria, right? But like, all our psych diagnoses are based off of criteria and are just like, you know, they're based off of symptoms. You know, because there's not like we look into your brain and are like, okay, yes, your brain looks like it has PTSD, good, right? There's a screener you can do called the PCL5 for like PTSD symptoms. So you could do that. That's not a diagnostic tool. It doesn't diagnose anything, but it helps to make sure that you go through all the symptoms, and you can take that to a psychiatrist, and then any psychiatrist can diagnose PTSD. They can say they're not comfortable with making the diagnosis, or they're not sure, but I think probably what they meant though is that like, of the things that I think that you have, right? Like, I think you probably have anxiety and PTSD or PTSD, right? And if the question is like, well, do I have anxiety or do I have PTSD? I think it's a reasonable answer to say, you know, I'm not really sure. I could argue either point. But the nice thing is the medication to treat anxiety and the medication to treat PTSD is the same. So at the very least, we know we're like probably going down the right path, even if I don't exactly know what you have. I'm hoping that's probably what they meant. But yes. Okay, let's keep going. Let's keep going. Let me look through chat. I'm so behind. I'm so behind on chat. People, hi Lev, hi Daytimed. Thank you for following. Sounds like those of us who are busy just have checklists and then do. Ah, my God, Bonehead, you hit me right in the forehead. A question about some heavy stuff. Let's try to avoid heavy stuff if possible, please. If it's like heavy, non-specific heavy stuff, sure, but like personal heavy stuff, let's try not to. Yeah. If they hated me, that's okay. I will be fine. I will find better friends. But until they prove it, I won't worry about that. Yeah, exactly. Like, it's okay. It's okay. I mean, that's the thing with like exposure therapy, right? Oh, someday I should talk about exposure therapy. I love exposure therapy because it's actually like helped me a lot. Even doing it like unintentionally. Like at some point when I was in school, I realized like, oh, Lev, if you're anxious about something, it's probably because you care about it and the outcome matters to you. And that means that it's something that's important to you, right? And so then maybe you should just go do it. Maybe if something's making you really anxious, it's a sign that actually you should go do it. And then I did that for like a year or two because I was like, all right, my theme of the year is, I don't even remember what word I used, but I was like, just doing the things that make me anxious. And I had a great year. It was great. I like auditioned for a play, you know, I like joined a club. It was great. I spent more time outside than I ever had. This was like a long time ago, but I kind of stopped doing it after that, but like it really helped with my anxiety that year. Thank you for following The Evening Dream. Oh yeah, it's like heavy stuff, combat related stuff. Oh, okay. Well, you can always ask it in the venting part of the Discord. And if I have something that I can say or that I feel like is appropriate, then I will do it. One thing that really helped me deal with anxiety around things I care about is the saying people who master something have failed at it more times than a novice has tried. Every failure is reframed as a brick towards mastery. Yes! That is so true. Wait! Have you guys ever heard of the pot making analogy for this? Because it's so true. And it's like something I tell myself all the time, try to break myself out of my perfectionism because I do it a lot. Okay. The pot analogy is an art class teacher is teaching pottery to her class. And she tells one half of the class, you have 10 weeks to spend on one pot and just make the best pot. That's your goal. I want you to make the best pot. You have all 10 weeks to make one pot. And then the other half of the class is like, you have 10 weeks to make as many fucking pots as possible. Just make as many as, I don't care if they're good. Just make pots. Just make a ton. You know, turn them out, right? And so, and like the analogy continues, and I don't even know if this is like a real thing that someone did, but it's like, oh, the side that was like, you have to make one perfect pot after 10 weeks was like, okay, I need to plan this all out. I need to do some research. I need to, you know, what is the best method? What is the best clay? What is the best design? What is the best form? How do I do technique? You know, and they do all this preparation and they're working laboriously. And the other side is just like, here's some shitty pots. And we just keep going. And then at the end of 10 weeks, who has the better pot? The side that just made a bunch of pots. Because, like, there's things that you can only learn by doing. And there are times when being perfectionistic or just, like, preparing to start to do things just doesn't help, right? And so, to me, that's kind of the point of that, which is that, like, you get closer to perfection by not being a perfectionist. which is really unintuitive. But I was thinking about that this week when I was, oh, you guys might have seen, I'm trying to teach myself how to rig. I got like a really, really cute, like cartoony model from Isunim, and it's so cute and so cute, and I love it so much, and I was like, I need to see her move. And so I've been trying to rig it, and what I sort of realized is like, at some point when I was like rigging the eyes for the first time, I was like, this doesn't look right. And I was like, I can keep messing with it, or I can just like start over, you know? And so I re-rigged it like 4 times in 4 hours. And at the end of the 4th time, it looked so much better. Because like, I don't even know what it is that I learned, but I learned something by doing it multiple times. And I was like, oh, this is great. I'm really happy with the eyes still. Back to what I asked before, experience a year of pain. How do you deal with that while others continue to place expectations on you? Well, I guess the question is like, what are your expectations for yourself, right? And that like, it's like any person, every person needs support from the people around them, even when you're not dealing with a lot, even when you're dealing with like a normal amount of stuff. So that's what I would say. Lev, how long does it take to become a doctor? Undergrad, grad, and med plus residency, also a specialty. Okay, so it is different in different countries. So the UK does something totally different. I say the UK because I'm most familiar with it. Other parts of the world do something totally different. But in America, it goes like this. You graduate high school, presumably. You go to college. Most colleges are a 4-year college, right? You do your 4-year undergrad degree. You can do any degree that you want. But you do have to finish a bunch of prerequisite classes, right? So like you could be an English major, but you do still have to take like all of intro bio and a 2nd year of bio and all of intro chem and then organic chemistry or whatever the requirements are these days. Every medical school has their own set of requirements, but they do tend to overlap. And so then after that, you have to take the MCAT. Well, you have to graduate college, take the MCAT, apply to medical school. The thing with every application process in this system is that it takes like about a year. Like if you're applying for, people who are applying to start medical school next year have already put in their applications like 3 or 4 months ago. It's a year-long process. It takes so long, you know, it's really, really annoying. And then you do medical school for 4 years, although there are now some places that do it faster. And then in your 4th year, you apply for residency. And in that, you choose your specialty. So residency is anywhere from like 2 to 4 to 7 years. And you can subspecialize after that if you want to with a fellowship, but you don't have to. So yeah, it's like at least 10 years. On average, probably more around like 12 to 14. Between college, med school, and residency. Lev! How much medication knowledge would the average person expect a psychiatrist to have? How does someone with ADD, ADHD, or more serious mental health issues know how much to trust their pharmacist versus therapist versus psychiatrist versus pharmacologist, etc. about medication recommendations? Well, a psychiatrist is probably going to know more about like specific indications for each medication, right? And the sort of situations of like, well, this worked, but then this didn't work, and then this had this side effect, but that had that side effect, and maybe this person has this, or maybe they have that. Like that sort of situation, a doctor's going to be better at. Whereas like specifically like medication interactions or like what does it do very, very specifically in the body, like receptor profiles and stuff like that. Some psychiatrists know really well, others don't. And those your like pharmacists are going to know much more about like specifics. In terms of like, oh, this med and this med tend to be used together because this receptor potentiates that other receptor, which makes it more effective at XYZ, blah, blah, blah. Or you should dose it at twice a day because the half-life curve goes like this, and that means that the absorption in the gut is the... So I'm making that up off the top of my head, but that is the sort of thing that a pharmacist would be much better at. I love when I have a pharmacist to talk to. They're so helpful. Are they not interrelated though? I mean, kind of, but not really. You know? Yeah. It's kind of, but not really, because like, especially with, well, this is true for most specialties, I would say, or for a lot of medications, right? That like, sometimes there really isn't necessarily a reason to pick one thing over another thing, but those like really edge cases, the really specific stuff, the really weird stuff, you know, like the person who's on 40 different meds, or the someone who's like, I have a very specific allergy, or like I don't have a kidney, or whatever, then like the person who's actually done a lot of training specifically on medications and how they interact with the body is going to have a much better time, because they're not trained, for example, in diagnosis, right? Which is what a doctor is more trained in. That's why it's like interdisciplinary, right? Like we have an idea, and like the big things we probably can catch, but like little things, nuances are more of a pharmacist's specialty. And then therapists don't really, as far as I know, get as much training on the treatment part. They definitely get a lot of training on diagnosis, but in terms of like the nuances of how diagnosis feeds into what treatment that you would recommend is a little less of a therapy focus, because they don't do meds. Psychiatrist horror stories? I mean, my horror stories are all like people are kind of sad, you know? Like, oh, this person's really mentally ill, and so then they punched a hole in the wall. You know, that sort of thing. McQueen, where are you from? I'm from Earth. Lev, how much do you trust the healthcare system and insurance industry? Ha! Interesting question. Basically, again, this is Lev's personal opinion and does not reflect medical advice, my professional medical opinion, or anyone that I happen to work for. But my thinking is, in general, most healthcare professionals that I've worked with, people who work in healthcare, are genuinely good people who want to help others, right? Overall, I tend to trust people, right? Like the people who make up the healthcare system. On the whole, though, there is, like, generally speaking, large motivations towards not just patient health, right? Like, I feel like for each individual person, the most important thing to them is almost always what's best for the patient, right? But then overall in the industry as a whole, I don't know that that's the only motivation, right? Sometimes there's other motivations, like money, obviously, for example. And even though each individual person doesn't necessarily have a motivation for money over their patient, and honestly, it's kind of hard to, as an individual person, to like put money over your patient anyway, because like people will say things that like they think that doctors will get kickbacks if someone stays in the hospital longer, or if someone takes meds or whatever. And it's like, I don't make any money off of that. Like, as a doctor, you make money when someone comes to see you, but they can choose not to come see you. And if I give you meds or I don't give you meds, it's like the same. If you stay longer, if you stay shorter, it's the same, you know? Yeah. And so like but these individuals are working in a system that is that's oriented towards like wanting to make money, right? So then there's going to be a lot of pressures on them that are secondary considerations, but are still influences and considerations. So like on the whole, it's just like not great, you know? Right? Because like people are stuck in these horrible decisions where it's like, well, we don't want to try, like we want everyone to be able to get the highest quality everything, but do we want to still be able to give people care at all, you know? I don't know. It's hard. Where do you put your money? So, it's hard. It's hard. It's hard. Thank you for playing wee 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 wee. Yeah. Yeah, Winter put it simply. The people who care, I trust. Systems and corporations, I generally do not trust. Yeah. Thank you for following. Buffy follows bottoms. Thank you. Is it true some doctors are sellouts and partner with certain companies to sell that company's medication? I don't do that, and I don't know anyone who do that. So, like, not really. Not really. And I don't think anyone explicitly partners with a drug corporation. Like, any of those situations, like when you think about, what was it? Like the opioid stuff that became like a really big problem, which understandably it was a big problem. I don't think that anyone was like directly paid, but it was more like, what's the word for it? It was more like anywhere from like subliminal stuff, like, I'm just gonna give you something really nice. Like, you don't have to give our medications, but like, it's something really nice, and while you're eating this really good food, I'm gonna tell you why our medication is perfect. And like, you don't get anything, but maybe it like makes your opinion more positive. All the way to like, let me give you things. Here's gifts, unrelated, but here's gifts, you know? I don't know that anyone is ever on the books actually being paid to promote things. Like placebo? Or I guess it's more like positive associations, right? Like more like, yeah, favors, celebrations, dinners, golf trip, yeah, that sort of a thing. I think. There are ways, I think online, there are ways to see if your doctor has gone to drug rep, like dinners and stuff like that. Hi, hope you're doing well. Thank you, Buffy. I'm assuming that's your name. I see I've just seen pharmacists and doctors, including psychiatrists, get into disagreements about interactions and what is best with the patient stuck in the middle, but thanks. Oh, okay. Well, so this is the other thing, right? Which is that no one actually knows everything, which I guess is obvious. No one actually knows everything, and so you can even agree on things like this medication causes this interaction, or this medication deals with this receptor, but then people can disagree on like a lot of the specifics, right? So people will say like this and this has been shown to have worse outcomes, and then you can argue, and this is where expertise is helpful, but also like, I don't know, things overlap. Like, for example, let's say that like this medication will cause this, is 80% likely to cause XYZ side effect, but is also 75% likely to improve ABC symptom, which is causing the patient some amount of discomfort. And it's like, well, then how do you decide? Right? And people will disagree, and the patient is involved, and the psychiatrist is involved, and the pharmacist is involved, but it's like, people are going to reasonably disagree. There's no right answer. It just depends on the specifics. Lev, I just went through the toughest and most shittiest experience. The doctors want to hear about it. I mean, I suppose. I hope it wasn't that bad. But, you know, yeah. I apologize on behalf of doctors. Gotta love incentives. Yep. Ignorance is the worst sin from a doctor. I mean, yeah, you would hope that, well, I think more than ignorance, I think it's like unwillingness to learn, you know, or unwillingness to acknowledge that you could be wrong. Just posted my question on the vent thing. I look forward to your personal advice, Lev. Okay, let me take a look. I might have to wait till after stream, depending. Let me see. Where is my Discord? Ah, okay. So, Yuki, what you're talking about, it sounds like... It's not what you're talking about. It's like PTSD. And... Ooh. I don't know that I have a good answer other than this is the sort of thing that therapy is really helpful for, and medications, because this sounds like PTSD. Yeah. And that's like, it's kind of like I was saying with like the anxiety demon. It's like not something that you can like logic at, right? You can't, because it's not gonna feel real. Like it sort of falls flat. It's like when you're feeling really, really upset and then someone comes up to like I don't know, like if someone's like, oh, my cat died, and then someone's first thing, they've never met your cat, they're like, oh, well, at least he was old or something, and it's like, that's not helpful. You know, and so there's like some things, there's only so much that you can do on your own, and sometimes you need to reach out to others for support, and it sounds like that's the situation, maybe. At the very least, I don't think it'll hurt. Bum, bum, bum. Welcome to tumor board. Yeah, literally. That's literally every tumor board. It's like, should this person get this surgery that has a 50% chance of killing them and a 50% chance of curing them, but then there's all these other modifying factors because they have this risk factor that makes it worse and this risk factor that makes it better, and then also they're 25 and also blah 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 blah. And it's like, it's impossible. I don't know. Ignorance, arrogance, and greed are the 3 worst qualities in people. You know, when I first read that, Winter, I read ignorance, arrogance, and weed, and I was like, what? Weed? Weed? Sorry. Also, you guys have like talked to me so much. I have like not eaten any of my lunch. But yes, those are horrible things. Lev, do you follow your own advice you give to patients? I try. I don't. I definitely don't. But that doesn't mean that like I don't believe that it works. Right? It just means that it's hard. It's hard to follow a doctor's advice. Because doctors have a hard time following a doctor's advice. So it's like not that simple. This is why, like, for example, as a therapist, like my supervisor, who was always talking about like giving people homework for therapy, and like, for example, like the behavioral activation thing that I was talking about, right? Like every day try to do something that gives you a sense of pleasure or a sense of mastery. Like if I assign that as homework for a patient for the next week, I'll do it myself for a week, right? Like that's the idea. That's hard, you know? It's so hard. And like even simple things like eat well, go to the gym, sleep. I tell y'all to sleep, but I'm also like not great about my sleep hygiene sometimes. So this is why I think it's also important for doctors to be like self-aware, right? And to remember that you're also human. Being a doctor doesn't make you immune from being human. Being a psychiatrist doesn't make you immune from being human. Like, there's things I can help other people with, but then like I also have anxiety and I also see my own doctor, you know? Because we're like horrible at seeing ourselves clearly as people. Did you hydrate? You've been answering questions for quite a bit and ready to hydrate. Please take a pause if you need to eat and drink. Okay, I did not hydrate. Let me do that. Go to the doctor. Okay, yes, I know. I know. Lev is like, every doctor hasn't seen her own doctor in age. That is actually so funny because my husband and I have this funny thing where like we share doctors, obviously, right? Because it's just like easier. But like the ones that I go to see regularly, he doesn't, and the ones that he sees regularly, I don't. So like he went to our PCP the other day, and our PCP was like, "Where's your wife? Where has she been?" Meanwhile, like I'm like religious. I'm like semi-religious about going to the dentist. Like oh my gosh, I have so much fear over teeth stuff. So I go to the dentist every 6 months on the dot. I never like move and every single time I go, my dentist is like, where the fuck is your husband? And I just like, both of us are just like, I don't know, man. I don't control them. I look like, where is your husband? I haven't seen him in like years. So doctors have doctors? Indeed. It's a whole chain of doctors. It's a whole circle of doctors. I mean, it's like especially a thing in psychiatry, right? Because like the classical thing for psychiatry training is that if you're going to train to be a psychiatrist, you also have to see a psychiatrist. It's less of a thing now. It's not required anymore. I used to be, but it's not required. But like psychoanalysis training, for example, if you're doing psychoanalysis training as a doctor or as a therapist, I mean, you're expected to go to psychoanalysis yourself, which is pretty intense, I hear. I knew someone who did it, and he was like doing 1 hour psychoanalysis sessions every day, 5 days a week. I was like, whoa, that's 5 hours of therapy every week. That's a lot of therapy. That's a lot of psychoanalysis. And he was like, yeah, it's very interesting. You know, it's for some people, it's not for me. Thank you for following, Ryer Tax. Thank you for the follow. Cookies and Cream, thank you so much for subscribing. Thank you. I don't know why the subscription thing didn't go off. I hope it did. Maybe it did and I missed it. Thank you so much for the subscription. Whoa! Welcome, welcome, welcome. Oh, you get to access to the special Discord channel, by the way. I'm gonna be posting some more sneaky peekies there because there's some really, really fun stuff coming up. Guys, I'm so excited. There's some really cool, fun stuff coming up. OMG, I love your hair! Green's my favorite color. Heart emoji, heart emoji, heart emoji. Thank you! Motaka. Yes, it is at !Discord. Sujo, you haven't been to the dentist since graduating high school 5 years? Go to the dentist. No, the reason I'm like religious about going to the dentist is because I didn't go to the dentist for like 5 years. And then it was horrible. And then like, thankfully, nothing serious happened, but they did have to like numb my face to do like a deep cleaning. It was horrible. And I never wanted to happen again. And I don't want to lose my teeth. So I was like, okay, you know what? I'm flossing every day. So please go to the dentist. Please, teeth are so important. Teeth are so important. You know, if you get a tooth infection, it can lead to a brain abscess. It can lead to like bacterial growth on your heart that gives you a heart attack or a stroke. Like it can really escalate to something really bad. So take care of your teeth. And the span of things that could happen, deep cleaning is really not that bad. That's what I'm saying though. It was really, really annoying and so like, because my face was numb and I started like biting my tongue and was just really, really bad. And I was like, if it was just, if just getting a really deep cleaning is this annoying, I don't want to have any real horrible mouth issues. Motaka has to go. Okay, bye. I brush every day twice. Floss and use mouthwash. My mouth feels great and no cavities. Well, then it shouldn't hurt to go get a quick checkup. They'll just confirm. Okay, everything's good. Okay, cool. You can always say no to anything they want to do. That's why eating healthy matters so much. Yes, it does. I had like thousands of hours of therapy. Giving thousands of hours of therapy. Yes, that's a therapist. That's just like what you end up doing. You give therapy, take therapy, give therapy, take therapy. It's great. Rare Tax, thank you for your first time chat. LMAO, I just came back from my dentist. Whoa. Nice. Thank you. Good job. I'm proud of you for taking care of your health. As a doctor and as a person in the world who wants you all to have a nice time and a long and healthy, prosperous life. Go to the doctor. Prevention what is it? Like an ounce of prevention, like, yeah, it's, it means so much. And I think we don't tend to think of our lives like on the lifespan of a lifespan, as it were. Wow, that's not a sentence that makes sense. That's not a sentence that makes sense. I think we tend not to think about our lives in the context of our entire lifespan. But like, sometimes I like to think about how what I do now probably has an impact on how good my life is going to be when I'm old Lev. And I want old Lev to have a good time. I want to be able to walk, and I want to be able to use my brain. So those are my goals. So I gotta work on that now. I'm not great at it, but I still think about it. Unfortunately, genetic plays a huge role when it comes to teeth. Apparently. Genetics plays a huge role in everything. Genetics plays a huge role in my, eyesight. My eyesight is terrible. And it's because of my parents. It just got like nerfed from birth. You know, like I've been wearing glasses my entire life. That's why my character, that's why Lev has glasses. Mine too, LMAO, I can barely see without my glasses. It's horrific, genuinely. Take my glasses off, I'm walking into a door. Like, I can't see anything. Thankfully, I went to see the eye doctor recently, so that's good. Speaking on eating healthy house of sandwiches, is it a healthy one? Plus minus. It's a smoked salmon bagel. So, it could be worse, but it could be better. Also, there was a hype train. Why is there a hype train? Thank you. My goal when I'm 100 is to be playing Mario Kart 2000 while flatlining as I cross the finish line on Rainbow Road. Oh my god. I would like to time my death for comedic purposes. Is crazy. Arbiter, hi! Hi, thank you for being here. I appreciate that this stream has gone from like some extremely like deep, thoughtful topics to some really weird shit. You know? That's great. I love that. I'm not even joking. Oh yeah! Rose, thank you for hitting the merch thing. There's merch! There's merch! If you want merch, go look at merch. There's merch for me and the other digital dreamers. It's really cool. Shall we go back to crying and trauma? No thanks. I'm good. Stickers? Yeah, there's Apple stickers. I wish I needed glasses. They look so cute on people. Bro. Can I tell you a secret? You can just wear glasses. You can just wear glasses. Just buy fake glasses. I wish I could just buy fake glasses. You know how much I wish I could switch what my glasses look like day to day? And I can't. Because they cost like $800. You know? So like you're stuck with like one look. Like I wish I could change, because like it will be so much fun to have like, you know, cat's eye glasses and then big plastic glasses and then the big circular glasses. Because like sometimes I think it would be fun to wear a statement glasses, you know, like a huge like a spectacle one. But like you don't want to wear that every single day. You don't want to wear those every single day, right? But then, are you gonna pay like $5,000? Not 5,000, but are you gonna pay like a crap ton of money to buy multiple pairs of glasses that you're going to have to update anyway? No. And even if you did have the money, to have multiple glasses, every time you change glasses, even if it's the same prescription, the exact specifications of the lenses are going to be different, so your eyes are still going to have to adjust a little bit. Like, I had prescription sunglasses for a while, and they're just, ugh. It wasn't worth it. I was like, this hurts my eyes. Also, my prescription is still changing! Once my prescription stops changing, maybe I can have that. Anyways. We need to set a collab time? Oh, yeah. Correct. That is true. We do need to do that. I would rather have eye issues than dental issues. Yes. I would also rather have eye issues than dental issues. Well, okay. Depends on the degree of the eye or dental issue in question. I'm terrified of becoming blind. Alright, I'm gonna go to the store, have a good stream. Okay, bye, Zai! Have a good store time. Statement glasses. Everyday wear. I mean, that's fair. That's nice, but like, I have to get new glasses every year. I'm free tomorrow if that works for you. It doesn't, unfortunately. I'm free on Friday, though. I'm so free, I scheduled 2 streams on Friday, so... I have sunglasses for my astigmatism and normal glasses. Ooh, nice. I also have really bad astigmatism. Well, it's Friday, I'm actually not... Okay, when are you free on Friday? Because it would have to be... I will say, it would have to be during the day. Like... work hours. I am a work hours streamer. I'm trying to get those valuable listen to me yap while you're trying to work. Mornings? Yeah, the morning should work. Because we're both like EST-ish, right? So the morning should work fine. The morning should work great, actually. I am free at 10 a.m. on Friday. Perfect! I was going to stream around them anyway. 10 or 10:30. I think it says on my little Chiron down here. I try to have it say, although, I don't know if anyone's looking at it. Is anyone even looking at it? 10:30 a.m. actually works perfect. Woo! We should figure out what we're gonna do. Sweats at the monitors. Are you working, Hika? No, you need to do your tracing, whatever it's called, as a radiologist. Then use your eyes to look at the things, the quadrants and the things, and don't miss anything. Minecraft, or we can just yap. Either's fine. Your schedule? We were looking at it, but you said it was only an estimate. Okay, that's fair. That's true. It's like mostly the case. Yeah. Yeah, we can just yap. I love to yap, as you can tell. I yap too much. This is where all of my yapping energy gets expended, so then I can be silent for 5 hours and like work on stuff. It's fluoroscopy. All the actual physical work is done. Just need to do a final review. Oh, are you IR? Ooh. That's crazy, bro. Hello! Bazooki8777. Lev, have you checked the mod chat in the server? Today? Yes. 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 Oh! Rose is head mod, by the way. Not that that necessarily affects anything for, like, most people. Today, I make people drink barium and see where it goes, essentially. Oh! Oh, that's so cool! I used to help with that. There's a mod hierarchy. Well, there is now. Just because I needed some help. I needed some help with, like, little things. Like organizing to make sure that there's always someone around when I'm streaming. Because my stream is at weird times for most people. I get to abuse the newbie mods. No, if you abuse anyone, you're out. Goodbye. Don't even joke about that. Shout out to Discord, fun chats after streams and more. Some community nights coming soon. Yeah. Heads, shoulders, knees, and mods. Oh my god. Oh, if you would like to be a mod applications are open also. Oh, awarded Denise. Hi. Do you remember me? Don't ask me that. You'll need to give me more context. I know it's not your first time here, and I vaguely recognize your name, but you will have to tell me what we talked about for me to remember, because I'm horrible with names. That's why the fact that they're in my, like, regulars, there's a Zai, a Zanza, and, like, 3 Zens, and it fucks with my brain on the regular. I'm just like, I'm so bad with names. You can't do this to me. Bone, how's your head? Pretty much filled with voices. What? Wee 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 wee. Nah, joking around, mods here have fun. Yeah. I think so. Oh, that's the other okay. Sorry, to answer the question about mod hierarchy. It's more that, like, I need a little bit more help with, like, platform stuff. Because I've been trying to multi-stream, but then what that means is that, like, and, like, until now it's been fine because basically everyone who's here is on Twitch, and so then, like, Twitch chat is, like, I understand how to mod, and, like, there's usually someone here, but, like, there have been, like, weird cases where, like, there's something weird that happens, like, on YouTube, and there's, like, one person watching there and they say something strange, and then there's no mods. And then I'm like, wait, give me a second. So I just need a little extra help. Yeah, sorry about the Z's in my name. Don't apologize. This is not a you problem. This is a me problem. If it's an anyone's problem, it's more just a life problem. I joined in a Cult of the Lamb stream and summoned a person named I remember. Yes. I remember. Hi, how are you? Bro, it's so good to see you. I didn't realize you'd be back. See, this is the thing. There are some people who, and this is totally understandable, right? This is totally understandable. There's, like, some people who only drop in for, like, streams for specific games. Like, there's some people who drop in for Cult of the Lamb, and some people who will drop in for Hades, or, weirdly enough, there were some, not weirdly enough, I was more just surprised that this person existed, and I was like, this is great. There was someone who's, like, a big fan of Trombone Champ who came for a Trombone Champ thing. Did you think I'd never be back? No, I just wasn't sure, you know? I'm just like, I don't know. Look, I have self-esteem issue. I have self-esteem issues, okay? I don't believe that I can hold people's attention just sitting here and talking. Apparently that's not true, but I still kind of don't believe it. I hope you're doing well. Thank you for coming back. What games bring you tons of joys? Oh, let me chew and think about that. People have lives, Lev. Okay, yeah, I know. No, that's what I mean. I'm like, you guys have so many more better things to do, you know? You have a Discord now. I do. Yeah, come join. Join the Discord. It's fun. I'm there every day. Like, right now, Discord is fun. It's very cozy, as Winter is saying, yes. And I might not like literally respond to everything, but I read everything. Yeah. Like, I literally have no open notifs for my server. I will read everything. So, games that bring me joy. That's hard. Okay, because the thing is that I've watched a lot of games also, because my husband plays games. I've watched him play a lot of games. So for example, the game that probably brings me the most joy is probably, it's like God of War. Yeah. God of War brings me a lot of joy, especially the Norse ones. I really like God of War. It's so good. It's so well written. It's so fun, you know? When I finally, like that feeling of like, okay, not killing, but beating Baldur at the end of God of War 2018, it was like a feeling of mastery that was like so fun. You know, I was like switching between the axe and the blades and able to actually target. And when you get in that flow state of like you're not actively thinking about the inputs that you're doing and you're just like going, it was such a fun experience. It was great. New or old, I've played all of them. I like all of them. I like all of them. God of War was my introduction to console games and stuff. Flow state is such bliss. It really is, and it's also really hard for me as a person to get into that kind of state. I am like a chronic overthinker. You know, I'm always just like, my brain is always like bees. It's just like so when I can just like lock in, like actually lock in, it's great. Hi, thank you, Void XDYT7. I'm wondering what those letters stand for, but hi, thank you for your first time chat. Magic the Gathering is the answer. Okay, I do love Magic the Gathering. I do love Magic the Gathering. Speaking of, my Avatar The Last Airbender Magic the Gathering cards should be coming today to my house. I'm so excited. I'm so excited. It's difficult. I had to get coached for a year to finally lock in flow state. It's easier now. Wait, coached on what? Specifically why I picked up competitive FPS games like Valorant. Okay, that's the thing. That scares me. That scares me. Valorant, COD, what's it called? Anything that involves like live with other people. Oh god. I'm only comfortable with a single person games, you know? Single player games. Like, I don't want other people to depend on me. I don't know what I'm doing. I have such a bad sense of direction. Guys, I was trying to play Mass Effect, because I have Mass Effect on my PS5, and oh my god, literally, like, it's not even that big part of a map. I, like, didn't realize that there was a mini map that I could access, first of all, and then because I didn't realize that, I, like, went in circles in this, like, tiny area for, like, an hour. Because my sense of direction is absolute dog shit. Like, I was like, oh, okay, I think it's this way. And like, no, we just came from this way. So it must be in the opposite of this direction. And I go the opposite. I was like, well, now I don't see a way for me to go. And now I guess maybe it's unintuitive and I should go back the way that I came and I'm supposed to backtrack. And you weren't supposed to backtrack. It was actually intuitive. I just was blind and didn't know that I had access to a mini map. Something about wait, I don't know if I'm allowed to say this, something about VTubers. Am I allowed to say something because it seems like self-promo, but I don't want it to be? Oh. Well, I appreciate you asking. You can say it. Yeah, especially if it's like kind of unclear. Now I can tell you. If it's like not something that we allow or like quote unquote against the rules, then that's fine. Residents are back. Lol, take care, y'all. You can't let the residents see that you're watching a VTuber. Why? Go be a teacher. Valo is fun, but people are sweats. I don't know. I run a huge Minecraft server. And it's such a friendly and sweet place. That's good. I'm glad. We should just do exposure therapy in Minecraft. Okay, Minecraft doesn't totally count. Minecraft doesn't totally count. Minecraft doesn't totally count because it's not like competitive, really, you know? Yeah, and I have played all of 5 hours of Minecraft in my life. Yeah, used to be a really competitive COD player, but now my anxiety, or perhaps I just get overstimulated. My heart can't handle the adrenaline rush from PvP shooters. COD in particular, I feel like is really bad. Because like when I've been around like my friends and my husband when they play COD, like all of a sudden they get really irritable. I was talking to one of our friends and he was like, yeah, you know, even when I win a COD match, I don't feel happy. I'm just like, okay, well then that's a sign that maybe it's not very fun. I'd have put VTuber under tags in Discord because I do want to be one, but I'm not one yet. Then just put it under your tags, that's fine. Yeah, go for it. It doesn't really matter. If we need to change it, we can change it. Do you use landmarks or street names coordinates for directions? No, because those also slip out of my head. Well, I use landmarks. I just use like vibes. I'm like, this house is where I turn left, I think, roughly speaking, you know? I used to fence competitively. It's too late though. Oh, I think if you can always go back to, where is it called? If you scroll to the top of the left side, it should say channels and roles. And you should be able to click that. And change it. You should be able to. Oh, Pinoy Boy, you said hi. Hi! I did see it. I just didn't respond. Modded MC is tons of fun. I have heard. A lot of people I know play Cobblemon. And then there's the Cottage Witch Pack, which I've played for 5 hours. It's too late though. Oh, wait, what is your Discord name? We can change it. Or just like say somewhere. Yeah. Like ask somewhere. You can at mods. And we can change it for you. It's not hard. Valorant is my other competitive enjoyment. Is it enjoyable? I don't know. I can't tell. I really want to play something like Valorant or Marvel Rivals or Overwatch or something because it seems really fun. I just didn't ever have friends to play it with. Sad. And then I was like, it's too late. I'm too bad at this. I can't do this. I don't understand. Mouse and keyboard is so confusing. Okay, that's the other thing. I don't understand mouse and keyboard like controls. I can't do it. It took me forever to be able to use a handheld controller to begin with. Like a handheld controller is hard for me. Or was hard for me. When I first started using a handheld controller, I like couldn't do like both of the direction sticks at the same time, like that thing. I would be like, I need to turn my whole body left and then go forward. Or if I need to move to the right, I need to like go right and sort of just sidestep my way. Like I would go downstairs, like spiral stairs in like Spider-Man, which was one of the first games I played, like facing forward and going forward, facing forward and going left, facing forward and going backwards. Because I'm just like, I can't move the camera and also move the direction at the same time, because then I end up in the wall. I think I sorted it. Okay, cool, good. Valorant. I started in Iron. I don't know what that means. Oh, the lowest rank. I ranked up to gold on all roles in Valorant. It was so fun learning the fundamentals. I'm not sure what that means exactly because I don't know what the ranks are, but that sounds good. What do you think VTubers would have been called if they didn't appear on YouTube first? V-gamers? V-twitchers? I don't know. That's a good question. I mean, I think it kind of depends, right? Because I think VTuber also comes from like YouTuber, right? So it's like, what would YouTubers be called if they weren't on YouTube? Like, I don't know. Yeah, V streamers. I think livers is also one that's like a. I think that's like Nichi Sanzi, like a JP sort of a thing, but that's also a thing. Yeah. I don't know, V something, or like avatar something, anime something, I don't know. I guess like how would you represent that they're like not a real person and there's this live 2D situation, you know? 2D streamer, 2D tuber, you know? I don't know. Art tuber, virtual tuber, something like that. Iron is bottom 1%, gold is roughly 50th percentile. Oh, it's by percentiles? I guess that makes sense. But that's like so... That's hard. That's hard. Basically, I'm a wannabe VTuber, but still, it's okay. If you want to be a VTuber, then you can be a VTuber. That's how it works. I like thought about it, decided I was going to do it, and started streaming like within like 2 months. Because I'm impulsive sometimes as a person. It's a bell curve. Well, yeah, that makes sense. I think most things are bell curves. I just feel like comparing yourself to other people is always like an exercise in feeling self-conscious. No matter what, even if you're good about it, you know? So that's why I don't play ranked Magic. And that's why I never played a ranked chess. Because I don't like it. I don't like thinking about that. But game is so enjoyable with friends and also has non-ranked game modes. I mean, I don't care too much about ranking. So, like, it's okay. I can do it, but I think the difficult thing is when, like, the entire population is also moving in a certain direction, right? So, like, if everyone is also getting better at the game, then it's kind of hard to compare where you're getting better, if you're getting better than other people, if everyone is also getting better. But I guess as long as there's enough new people starting, then it should be fine. I think it becomes a problem when, like, the population of people who are playing the game is the same and it's not growing with new players. So then no one is a newbie, and so then you're always being compared against people who have been playing the game. Right? Like, I imagine that that could be an issue. I don't know. Gotta go bye. Okay, bye. I realize I like haven't been paying attention to YouTube chat as much. I'm sorry, but also some of the stuff there has been weird. So I'm like, I don't know if I want to look at it. I'm gonna be so honest right now. Oh, thank you, Bonehead, for looking. For modding on YouTube. I appreciate it. The play styles and the meta evolves a lot over time and differs between each rank. Oh, I see. Riot does rank resets each year to make things fairer for new and existing players. That also makes sense. Oh yeah, I remember. I remember seeing that back when I used to kind of half follow Overwatch stuff. Like they would do like, you'd have to like play like 10 games in a row or something, and it would like put you in a certain rank. I don't know, there's all sorts of consternation online about these ranking systems, from what I can tell. Yeah, Overwatch is the same. Yeah. Yeah, I haven't followed Overwatch since... for a long time. I think since they announced Overwatch 2, probably. And I only followed it because I thought the characters were interesting. I never played it. Or I think I maybe played like once on someone else's computer. I wasn't very good, I'm gonna be honest. I did not know where I was. I did not know what I was doing. I don't know what was happening. I was like, oh. Okay, so I have us down for Friday morning at 10:30 a.m. EST. Yes. Correct. Yes. I believe so. Have you ever used VNet on VTube Studio? I have! Yes, I have VNet. So we can do that for sure. It'll be cute! It'll be cute, it'll be fun. We can talk about stuff. Overwatch is easy to start but hard to master. The learning curve is pretty steep. I suppose that makes a lot of sense, honestly. Perfect! I do it! Yeah! Let's do it! Let's do it! Let's see. How do you download Honkai Star Rail on a PC? I need to do that. Honkai Star Rail. Should I be doing this now? Probably not. But most FPS games have a steep learning curve but just feel really good to play. That makes sense. Honkai Star Rail is fun? Yeah, it is. And I'm sponsored by Honkai Star Rail for the next week. So I need to play it on stream. I've played it a lot off stream. I've played it so much off stream. Yo, hi! I am Pinpin. Hi, Pinpin. I just picked a random streamer to ask tomorrow. Oh gosh, okay. Tomorrow I have a biology test and I didn't study, and I have also a citizen test tomorrow and I don't know what to do, and it's almost 10 a.m. Almost 10 a.m.? But it is tomorrow, so you have the whole day. I mean, I guess it kind of depends. I've never taken a citizenship test. So I'm not really sure. But depending on how hard it is, I feel like that is probably more important. I feel like the citizenship test is probably more important if I had to guess, you know? But ultimately, you're the only one who can answer that question. Like, which one is more important for you? That's my question. Ah! Someone threw something at my head. Why? Ah, why? Why? Yeah, the citizenship test feels more important and more high stakes if you don't do well on it. Ah! Okay. Rude. Now no one can see my face. What is this? Who did that? So rude. Oh my goodness. Are the channel point viewer tags not— oh my god. Are the channel point viewer tags not working? Maybe, maybe not. Oh, I still need to make the bald redeem. Someone asked something about games. How long have you been a gamer? I mean, it depends on your definition of gamer. I've been playing games my whole life, but like a lot of like but a lot of like a lot of like more strategy games and stuff like that. So like I played a lot of Yu-Gi-Oh growing up. I played a lot of like mobile games, you know. So I played a lot, like for example, I put way too many hours into Puzzles and Dragons. You know, like way too many hours. I put a lot of time into Puzzles and Dragons. I also put a lot of time into Mouse Hunt on Facebook, which weirdly actually has like strategy to it. Like it's sort of like optimization games I really liked. So optimization, strategy, puzzle games. I've always really liked puzzle games. There was like one kind of match 3 puzzle game type thing that was like more complicated than Bejeweled. That was really fun. So yeah, in terms of games that affected me the most, or what was this? What was the question exactly? I forgot what the question was exactly. It was something about what games have affected me the most. Probably God of War. Again. Oh, Lev is one of those Candy Crush ladies? No, I've never played Candy Crush. I hate Candy Crush, but I do like puzzles. Oh, escape room simulator? That sounds fun. I've done real escape rooms. I love escape rooms. Yeah. He has no desire to stream. He is like the most offline online person I know. Do you know what his homepage is? Metacritic. He just like somehow engages with all of this online stuff with like no engagement in like the online communities really as much. He like vaguely knows what other people are talking about, but he's like not involved with them, you know? So like he always knows what's coming out. He always knows all this, but then like memes about video games, no idea. He has no clue. Mad respect. He just wants the information. Literally though. Exactly, yeah. He's like a whole encyclopedia of information. It's great. Like I can ask him like, when did this film come out? And he can be like, I know when this film came out. I know who directed it. I know who the cinematographer is. I know the other films that this director made in this around this era. I'm just like, he's great. It's so good. This is this is why sometimes we talk to each other and we're like, wait, are we neurospicy? Are we acoustic? I said that to him and he was like, what do you mean? Oh, it's for a citizenship course. Okay, not your actual citizenship test. Well, in that case, just study for whichever one is more important. And only you can decide, you know? I have diagnosed / confirmed ADHD. Well, I did see a psychologist and I did take one of those like one of the more objective tests and have been diagnosed with ADHD. I still sometimes doubt it though, because I doubt everything pathologically. So, but I'm pretty sure I have ADHD. I don't do anything about it though. With like meds. I don't take meds for ADHD. I didn't really like how it felt when I took them, so maybe I should, but you know, so far so good. So far so good. So I'm like, my psych said I might also be acoustic, but I chose not to get a diagnosis for it for career reasons. I mean, diagnosing autism spectrum disorder is really hard. It's really hard because the criteria are so vague, you know? And also especially for adults. I mean, it's true for ADHD too. For a lot of these things, it's like it has to be throughout your life, but it's kind of, if someone is already an adult, it's kind of hard to say what they were like as a kid. Because people remember things, but like, I can't say with 100% certainty that I remember what I was like as a child. Wow, that was the weirdest sound ever. I made that sound while burping or hiccuping or something. Which meds have you tried for ADHD and what are the differences between the various options? Well, ADHD, basically the meds are like stimulants, and there's different kinds of stimulants. There's amphetamines and there's methamphetamines and methylphenidate. If I'm thinking about it correctly, I think so. And then there's non-stimulant ADHD meds. There's not that many non-stimulant ADHD meds. Those are like bupropion. Oh my god, my brain is like blanking. I know what I'm talking about, I promise. I know. Oh my gosh, like guanfacine and some other ones. In any case, because I'm like, my brain is only giving me the brand names of it, and it's like not escitalopram. No, escitalopram's not for ADHD. Escitalopram is an antidepressant. It might help someone who has ADHD because it's often like comorbid with anxiety, but anyways, it's really just like stimulant versus non-stimulant. It's kind of hard to say. Oh, atomoxetine. Yes, that's what I was thinking. Yeah, I was thinking Strattera and I was like, and it was horrible. Yeah, atomoxetine is like a 50-50 is what I hear. Or, okay, maybe not 50-50, but it's sort of like, this is true for a lot of psych meds, is that sometimes it works and then sometimes it doesn't work. And we don't always know why. But yeah, it's like stimulants or non-stimulants. Stimulants tend to work across the board. Non-stimulants are kind of hit or miss depending on the person. But stimulants have a lot of side effects and are much more strictly regulated. Lev, as a psychiatrist, how do I get a woman to love me? Bro, that is a hard question. I don't know. Depends on the woman. Depends on you, also. Also, more importantly, it's not something that you can just make happen. I'm gonna be honest. Like, you can't game someone into falling in love with you. That's not how that works. You know? I feel like if I had to give advice on healthy relationships and stuff, being honest and communicating and trying to be vulnerable and helpful is good. But you are a woman, so I thought you could do some woman magic and make it happen. You know, I'm not connected to every other woman in the world, unfortunately. So I can't just brainwash one of them into loving you. Also, that wouldn't even be real. So, you know, that's not how it works. I'm sorry. You know, the advice of like be yourself when it comes to relationships is like so trite, but it's like very true. Because I feel like it's probably very, very, or it must be so exhausting to try to be someone that you're not, you know? For years and years, even in private. Like if you can't be vulnerable with another person, then that means you can't let someone fully know you, and not being fully known or fully understood by anyone is painful for any person, you know? And like, this is a thing that's hard, is that there's often a lot of reasons why it's hard to be vulnerable with someone. Sometimes it's that it's a bad match, but sometimes it's also because of stuff going on with you, right? So it's always hard to say. Oh yeah, the difference between generic and brand name medications is like very controversial. Or sorry, not controversial. It just like comes up a lot, and like I have not gotten anyone to agree. I have not gotten a consensus from people that I've talked to whether it's a real thing or not. I have seen some people say that it makes a difference, and some people say it doesn't. So I don't know. All right, guys. I can feel myself like flagging. My head hurts. My head hurts a little bit. Wah. My head hurts and my brain is like starting to go like meh, 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 meh. Ideally brand name, but if it's out of stock, then the generic is possible. Yeah. In the biomed industry, there are trade secrets and stuff. Interesting. Like right up against the mic. Can you tell I'm losing my mind? Only a little bit. Also, there's like 2 wee redeems as supposed to be a thing. It's kind of on accident, but you know, that's okay. I'll delete one of them someday. Spiritual _ Argonaut, hello. Thank you for being here. Hello. Hello. Yeah, I need to delete one of them. One of them, for some reason, like one of them triggers the like visible alert, and the other one doesn't. Which I don't know why. Hope your day has been good. Thank you. My day so far has been very good, actually. My day so far has been very, very good. Streamers are like houseplants. Water them regularly. I know, I do need to be watered regularly. Ugh. I'm doing some room cleaning right now. Oh my gosh, that reminds me. I need to clean my room too. Oh, we're like 2 follows away from hitting 420. That's so funny. Oh my gosh. Wait, no, I want to hit 420 on stream. I think that would be so funny. That would be so funny. I feel like if I end stream, then it won't hit 420. I'll be hitting it when I'm off stream. Thank you for following. Let's go. We are now at 419. If I get one more follower, I'll hit 420, and then I can end stream and go to sleep. Are you going to blaze it with 2 more followers? No, unfortunately, I don't blaze it. I have bad lungs. And, like, just general atopic fuckery going on, so I don't, like, drink or do anything recreationally, but, you know. Anyways, thank you for the follow. Hello, hello. You look like a pterodactyl? Is that what you're saying? You know? Sure, I'll take it. I cannot blaze anything or drink. Yeah, no, I can't either. I also don't really like it, not that I haven't tried it, but anyways, that's a whole other conversation. One more. I don't know if it'll happen this stream though. It might not. No. Oh, minor. Huh? Minor form of dactyl? What is that? What is the minor form of dactyl? What is a dactyl? Wait, I'm confused. I'm easily confused, but I feel like this is genuine confusion. Wee. You'd like it? I feel, for some reason, I feel suspicion about this set of chat messages. Slowly losing my mind in my room, that is what it feels like sometimes. Yes, that is me right now, slowly losing my mind in front of the computer. The laptop is going and my mind is going brain no work. No, brain no want no work today. Brain go boo. My brain don't want to work today. My brain don't want to work today. My brain no work today. Ba-da-ba-bum, bum. Alright. Lev reverted back to her baby form. Yeah, clearly I can't read anymore. Okay. Well, unfortunately, I think we will have to end stream without having hit 420. Sag. Nobody follow me. Nobody follow me until Friday. I just think it would be really funny to hit it on stream. But, you know, if I don't, that's okay. Thank you for the absolutely lovely stream. Aww, thanks, Winter. I had so much fun here. I'm so glad. Minor form of dactyl is basically you. I mean, I looked it up. It just is that the weird thing with a bunch of arms? I don't. Is the minor form of dactyl like a real thing? I'm so confused. It doesn't look good. Everyone unfollow just to be sure. Yes. Wait, why do are you saying I look like a ragdoll with multiple arms and no head? Oh, the poses. Okay. Everyone unfollow to make sure it's so funny. Yes, everybody unfollow so that you can refollow so I can hit 420. But yeah, no, Winter, I'm so glad you had fun. I always feel good when like other VTubers are like in chat and are like, oh, it was a good stream, because I'm like, oh, that means a lot. Thank you. Okay. Let me see. Who should I raid? Who am I following? Oh, yes. Peachy is streaming. Okay. Oh my god, my dock just went somewhere very strange. Wait, can you... OBS, 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 OBS. What the crap is happening right now? OBS, can you please put the dock... Okay. You know what? Whatever. Alright. We are raiding Peachy. Peachy, who is my sister. My sister. My loving sister. Peachy is someone who I really love and adore. She's amazing. She's a great streamer. She's one of my co-stream group streamer friends in the Digital Dreamers. She also has some merch out. We have a sticker together, like our logos together. It's really, really cute. I hope you guys have a great rest of your day. Thank you so much for joining me. Thank you so much for the wonderful questions that are very, 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 very thoughtful and thought-provoking and all of that fun stuff. And bye. Bye. Bye.